Hello to anyone joining in. This is going to be the Bachelor of Science in Public Health virtual open house. We're just going to give a couple minutes for more people to join in before we start off.
Lisa, it's about 3 minutes after. I think we could go ahead and get started if you'd like.
Sure, yeah. Welcome, everyone. This is going to be our virtual open house for Bachelor of Science in Public Health, and I'll let our program director, Dr. Levitsky, take it away.
Welcome. My name is Elizabeth Levitsky, and I am the program director for the Bachelor of Science in Public Health program. And we're going to take some time today to tell you about the School of Public Health and the bachelor's program. We have a number of speakers. They're going to talk about different aspects and topics. I'd also like to add that if you have questions, please post them in the Q&A feature at the bottom of the screen. And we will do our best to answer your questions, probably mostly at the end of this presentation, but go ahead and type them in, and we have someone that will be monitoring the chat. So let's go ahead and get started. The dean of our school is named Dean Smith, and he also teaches in our health policy and systems management, and is one of the faculty members in the bachelor's program. Very important, the mission and vision of our school is first the mission to advance the public's health and well-being through education, research, service with a focus of the issues affecting Louisiana. And we're working towards building a healthier Louisiana as well as a healthier population in the United States by having a workforce that addresses the core functions of public health and equip our students with data and knowledge, and with the support of our faculty and students. And next. So next, I'm going to hand it off to Dr. Carrie Brissolera, who's our Associate Dean in the Office of Academic Affairs.
Hi, good afternoon, everyone. So I'm Carrie Brissolera. Like Dr. Levitsky was saying, I serve as our Associate Dean for Academic Affairs. So welcome, everyone, this afternoon. So just like to tell you a little bit about the program, kind of from the curriculum side of things, and we could take a look at the next slide. If you have not spoken with Ms. Billiot yet or had any kind of communications with her via email or otherwise, you will soon. So she is our kind of go-to in terms of admissions. She will help you through the application process. She is there for any kind of questions that you may have throughout that that whole process and helps out with our orientation, just general overall troubleshooting. She is our savior in that regard. So she is definitely a good contact to have as you walk through the process of getting into the program. So a little bit about the program itself and how things are kind of laid out. We do have some prerequisites to get into the program. So it's designed as a 2+2. So you get your 2 years of the core overall kind of academic background, completing these prerequisite courses, 60 hours from any accredited university. And then you come to us for 2 years through the LSU online program. And this is a list of those prereqs. Then you move into the BSPH curriculum itself. So these are some examples of the core courses that we have that you're required to take. So everything from the health equity aspects to public health in action. We talk about the healthcare system, epidemiology, and then we also have a suite of elective courses that you are welcome to choose from as well. So we are pretty excited about the program that we've built and can't wait for you to experience that with us. So thanks and enjoy the rest of the webinar today.
Awesome, thank you. And then another cool feature is that this program can be completed the 2 years with Health Sciences Center in New Orleans completely online, which is exciting, but also a bit intimidating. But we do have a support system with LSU Online, and I will be your main contact or first person that you'll meet if you are going to be pursuing this degree online with us. My job as an enrollment coach is to help answer any questions that you have about this program during the research process. So what does that 2+2 that they refer to mean? How can I get these prerequisites? What if I'm missing any of these admission requirements? I can definitely help you navigate that and get connected with Dr. Levitsky, the program director, and advising you on your next steps. I also work as that liaison to connect you with the admissions office and speak with Isabel Biot in admissions and getting all of your documents in. It doesn't stop there. Once you are admitted, I get to pass you over to our retention team, where you get to have continued support during your journey with us. So with that being said, I will pass it off to my friend Amber.
Hi, everyone. My name is Amber Allen, as Lisa mentioned. So once you get passed over from the recruitment end or your first main contact, which is Lisa, she'll hand you over to myself as a success coach. I will be then your new first point of contact, kind of working you through your courses, getting enrolled, and then continuing your time throughout the program. I have been a part of the team since January, was recently moving from Orlando over to Chicago. So now I'm a local Chicago resident, graduated from UCF in English literature, and I've been working in higher education ever since. So I have about 6 years of experience in it. And my contact information is below. Like I said, you will get connected with me from Lisa once you've gone ahead and got admitted and are all ready to go. Some of the support that you'll be experiencing with me is going to be that first contact that Lisa again will set up, which is our welcome call. In these, we'll go ahead and go over some helpful orientation information for you, make sure that you're on track to get enrolled in time, have all your holds resolved, and have all your documents submitted. And then once you've gone ahead and gotten all that situated and Dr. Levitsky has advised you and you're all ready to go with your classes, I'll still be keeping touch with you, checking in periodically, making sure that any roadblocks that you encounter are resolved, and just making sure that you feel supported and enjoy your coursework. And obviously, as your student success coach, I'll be offering advocacy for you. So if you notice you have any questions or concerns or need anything to be kind of brought to Dr. Levitsky's attention, we do work closely as well. So you can always bring me those concerns and I can pass it along over to you. But that's a little bit about LSU Online and how we'll be supporting you throughout your time in the program as well. So I'll hand it over to the Office of Public Health Research.
Good afternoon.
Go ahead.
Good afternoon. I'm Ed Trapito. I'm the Associate Dean for Research. And my office also includes Patricia Arteaga, who is who works with me in the office to make things actually happen well. Next slide, please. So why is it, first of all, why would you want to do research? Well, the bottom line is to make advances in our environment, in our communities, in public health, in health policy, in the behavioral domain. Research is one arm, and the other arm is practice. But I'm going to talk about research for a moment. So we're very interested in research, and a lot of the faculty are involved in important research projects. Louisiana has a very interesting and dynamic population with an environment that is wonderful but has problems. And I'll talk about that in a moment. We do have, I won't say a disaster a year, but we have, we may have a major climate event, for example, a hurricane or a flood. It's a place we can look at emerging diseases. For example, when COVID came up, we all got revved up to work with that. We have high cancer rates. We're known for great food and alcohol. That can be a problem as well. So what our office does is helps you become involved if you're interested. We're interprofessional. We work well with the Louisiana Department of Health, and we collaborate with a variety of agencies in the community. Next slide, please. So I'm going to give you an example of two of our most exciting researchers and what they're doing. On the left, you see Dr. Adrienne Katner, who works in environmental health, but what she really does is she works with the communities and looks at what are the problems that communities have environmentally, and how can research that the community wants to have, how can that move forward and end up making a change in the lives and the environment for community members. Now, some of her work has been focused in lead, particularly lead in water, which is a major problem in Louisiana, but other things have to do with, for example, highways and living around highways and what they do to the community. Next slide, please. Another example is Dr. Chiquita Ferguson. Dr. Ferguson is an epidemiologist, and she's been very involved with our center that studies alcohol and cardiovascular disease and other chronic diseases. But what her focus has been on are what are the social determinants of alcohol use, sometimes other substances, HIV, and how does that relate to the development of cardiovascular disease and cancer and other chronic diseases. So she leads an exciting research program. And with that, I just want to say that we hope you find time and make time to become involved in research during your 2 years with us, and I'll pass it along. Thank you.
So next we're going to hear from Amber Brown in the Office of Public Health Practice. And this is, in addition to research, is an area that all of our students have an opportunity to participate. So I hand it off to Amber.
Good afternoon, everybody. So I just want to go through the staff members in our office before I actually talk about our role in the program. So the first person you see here, this is Dr. Williams. She is the Associate Dean for Public Health Practice and Community Engagement. She does serve in the role of just helping with that coordination and making connections with different organizations that you can work with. And this is me. I'm an instructor with Behavioral and Community Health Sciences. And what I typically do is instruct the course, the Service Learning Experience course. That's really my main role. So I will see each of you at some point in your program as you get towards the end. And lastly, we have Yvette Merritt. Yvette Merritt is an instructor for Behavioral and Community Health Sciences as well. She is really the gears behind all the work that the office does. She's coordinating with different sites for placements for students, which I'll talk about in the next slide. So the service learning experience is a great opportunity for all of you as you get towards the end of your curriculum. And what it does is, as the Center for Community Engagement, Learning and Leadership at LSU calls, it's a method of teaching and learning in which students fulfill the learning goals of their academic courses while serving the community. So in essence, what you're going to have an opportunity to do is actually work hands-on with different organizations and address real-world concerns. And what that looks like in the class is you being placed with an organization and committing to 40 hours of service within a community setting. Now, because this is a remote program and you all are in different locations, we do try to fit you with different organizations that are local to you. However, sometimes you may be working with an organization that's not local, but really the point is for you to have an opportunity to become familiar with public health and expose you to what it looks like as you work with organizations. Even though we do place students with organizations, if you choose to work with an internship, or you choose to find a fellowship, those are also options as well. But that's not a requirement because we do place you ourselves. And a lot of the course focuses on reflecting on those experiences so that we can see that you've had an opportunity to really dive into the work that you're doing, but also see the impact of the work as you go through it, and how does that correlate to the things that you're learning in class.
All right, so we've taken some time as faculty to tell you from our perspective about our program and our school, but I know you'd also like to hear from our students. So next we're going to have Megan Nelson talk to you about the organization that they formed this year for all of the students in the program. So Megan?
Hi, everyone. As Dr. Levesque said, my name is Megan Nelson. This past fall, we started the Undergraduate Association for Public Health Practice. The main thing that we focus on in our organization is helping students attain their academic and professional achievements, also helping improve the students' experience throughout the program. Move to the next slide. So I'm going to do a brief overview of all the officers. So first, I'm Megan Nelson. I'm the president. I'm currently a second-year student. I plan to use my degree to connect with hospital systems to better serve the different populations. As APH president of this academic year, my goal is to increase student activities and expression while increasing awareness of professional opportunities and resources. So I'm going to pass the mic to Megan Wordsworth.
Hi, everyone. My name is Megan Wordsworth, and I am the Executive Vice President of APHP Student Organization. It is my second year also in the program. I plan to continue my education in psychology and maternal health. My job is to help assist in professional resources and providing student activities. I also want to shed light on some of the activities that we'll be doing. There will be a turkey and ham giveaway at Inspire NOLA that we will be taking place in. We will be participating in Tuesday, November 22nd at 10 a.m. And so I'm going to pass it on to Caitlin.
Hi, everyone. I serve as the Secretary of APHP, and I am also a second-year student in the BSPH program. I aspire to work in healthcare management and also have interest in working in health insurance, just to ensure that individuals have access to quality healthcare. As I mentioned, I am the Secretary, and I strive to promote the rights and interests of the students, and I look forward to working with you all in this upcoming semester.
And this is Nicole Coleman. She is the Vice President of Social Affairs. This is her first year in the program. She aspires to work in public service settings such as government and nonprofit organizations, specializing in healthcare policy and management to ensure better initiatives are brought into action to provide healthcare equity to all students. She currently serves as the VP for Social Affairs. and promoting connectivity and collaboration amongst BSPH students. And here's her information.
Hi, everybody. My name is Danisha Benson. I'm currently wrapping up my first year in the program, but I am the Vice President of Community Service. So my role just involves coordinating service projects, both virtually and in person, for students to participate in. All of the projects deal with issues in the public health domain. And currently we're running 2 projects. One is a postpartum care kit project, and the other it's like holiday cards for children at St. Jude. So that's the kind of things we do.
Great, thank you all for telling us a little bit more about the student organization. So we have wrapped up the formal presentation about our program and the students in the program. And so we can now take questions or provide any additional information you might want about the program. And you can either put that in the Q&A box or just unmute yourself and talk. So we have one question. I have a major interest in how sustainability efforts affects the social determinants of health. Is there anyone working in or interested in sustainability and public health at LSU? Great question. And certainly, there are a number of different facets of sustainability that are part of public health. Certainly, Dr. Katner's work in environmental taps into that. We have a climate change course, which is one of our required courses in the program, which delves into not just sustainability, but those factors that are impacting the lives of populations around the world. And so it ties into that. I hope that was helpful. And if one of the others would like to jump in, Dr. Trapito, Dr. Brisolera, and talk a little bit about what you might be doing in your program or courses.
I can tell you that Dr. Rung is working on sustainability issues in terms of a people-centered approach of more people interconnected in the communities that allows them to become more resilient and work towards sustainability. And she's funded on a study that originally began in relationship to the Gulf oil spill. So she and Dr. Katner, and there are other people who have been looking at it in a variety of domains.
Okay, do we have any other questions? Oh, you're most welcome. Thank you. Are there any other questions? Well, if there are no other questions at this time, you have email addresses as well as our website. Also, you can Google us either through the School of Public Health or LSU Online for contact information for the program. And we would be more than happy to answer any questions you might have, provide you with more information. Or set up a time where we could chat with you, via chat or via email. And Lisa, if you want to just take down the slide. Great. All right. Well, that's all
Awesome.
that we have today. From everyone.
Thank you all for joining us. We look forward to hearing from y'all soon. Please do submit interest forms on our online page or visit the public health pages that we had shared. And yeah, hope everyone enjoys the rest of their evening. Thank you all so much.
And have a happy Thanksgiving. Thank you.